Добрый день, уважаемые коллеги. Мы студенты 391 группы стоматологического факультета Кировского государственного медицинского университета. Мы хотим представить вашему вниманию нашу научную работу на тему «Особенности проявления анемии у пациентов стоматологического профиля».
Features of oral manifestation in patients with anemia. Authors Tultаева Карина, Юркина Ольга, and Гагарина Илья. Federal State Budgetary Educational Institution of Higher Education, Kyiv State Medical University of the Ministry of Health Care of the Russian Federation. Faculty of Dentistry. Third year of study, group 391. Science Supervisor Leushina Елена. Department of Internal Medicine. Introduction. Dentists are increasingly paying attention to the manifestation of systemic diseases in the oral cavity. For example, anemia can be suspected at the reception even in the early stages. Anemia is a pathological condition in which the level of hemoglobin per unit volume of blood decreases and the number of red blood cells decreases. Dentists pay attention to such details as the color of the mucous membrane, of the vestibule of the oral cavity, gums, tongue, cheeks, hard and soft palate, the presence of edema, ulcers, bleeding gums, jamming in the corners of the mouth, changes in the salivary glands and the color of the teeth, changes in the shape and topography of the papil of the tongue, burning and paresthesia in the oral cavity also indicate the presence of pathology. We consider the topic as important because not all aspects are sufficiently covered in the literature. The knowledge and ability of a dentist to determine the early signs of anemia allow timely diagnosis and treatment, reducing the number of possible complications. Purpose: identifying and analyzing the changes that occur in the structure of the tissue of the oral cavity in anemia and also proving them by a clinical examination of patients with this diagnosis. Methods: the basis of the study was done analysis of questionnaires filled out by 50 respondents, as well as a clinical examination of the oral cavity of 5 subjects. The survey was conducted electronically through the Google Form service. The study participants were residents of Kirov and the Kirov region aged from 20 to 68 years. The average age of the respondents was 21 years. The onset of the disease in the anamnesis of the respondents varies from 6 months to 12 years.
Results: there are 15 of the participants in our survey. 27 of them report the presence of highlights, which is 54% of the total number of respondents. 41 people caused exclusion of stomatitis. 36 survey participants note the pallor of the mucous membrane. 31 of the respondents noticed a decrease in salivation and dry mouth. 29 respondents note a bright red tint to the tongue. 32 people reporting bleeding gums while brushing their teeth. A change in the color of the enamel to a yellowish tint was noticed by 32 respondents.
Among the examined patients, in 40% of cases, there is a lesion of the mucous membrane of the lips, highlight herpes. In 100 of cases, there is a pale mucous membrane of the oral cavity. This diagnostic sign is the leading on the anemic syndrome in dental patients. In 40% of cases, stomatitis has detected. The remaining 60% of patients during the survey indicated its frequent occurrence, at least one time per month. Bleeding gums during the examination were not observed in patients. However, in 20% of cases, the patients noticed bleeding gums when brushing their teeth. When examination the tone in 20% of cases, you can notice a change in color to bright red while no edema has absorbed. The enamel of teeth of patients in 80% has a lowish tint. To a greater extent, premolars and molars undergo color change less often in incisors. The results of clinical study confirmed the results of survey. Of most significant diagnostic signs of anemia in dental patients are pallor of the oral mucus, frequent occurrence of stomatitis in history, and on examination lesion of the lip mucus in the form of peeling, cheilitis, herpes, yellowish enamel. The inseparable connection of blood diseases with lesion of the oral mucus indicated the relevance of the problem of studying the characteristic of the course, timely diagnosis, differentiated treatment, and prevention of the recurrence of diseases of the oral mucus in patients with anemia. Благодарим за внимание.